Well, welcome everybody to the special CCO panel discussion with Trillium and HealthShare as the first part of our Multnomah County Collaborative. Sean is actually going to, well, I'm Deanna Simon. I'm one of your regional outreach coordinators for Multnomah and Clackamas counties. And Sean is going to facilitate this part of the meeting, and then I'll jump in later on. So I'm going to pass it back to Sean.
Thank you, Deanna. Good morning, everybody. My name is Sean Snyder. I am, of course, the other regional outreach coordinator, as well as we've got Liliana on our team for Multnomah and Clackamas. We're going to dive into the special CCO session with Trillium and HealthShare. We've got Masara here today for Trillium, and we've got Jeremy here to help represent HealthShare. So the topic, if you guys remember, we kind of went into doing a little bit of discussion last time of what do assessments look like, or when folks are joining, what does that new packet look like? What are the first things that they're going to be receiving? And how can we better help clients kind of know what are going to be those next steps when they first join their CCO? So that was kind of the hope for this next topic, was really to look at new member care assessments, or what kind of care assessments go on when a member joins Trillium and HealthShare. So we're going to have them share today what that process looks like for both of them. And I can go ahead and stop sharing if Masara, you want to introduce yourself and dive in.
Yes, thank you, Sean and Deanna and everyone. Hello, this is Masara Iwaz-Ransom. I'm the traditional health worker liaison with Trillium Community Health Plan. So let me share my screen. So as we were looking at this topic of basically, assessments, it makes sense for us to look at us to really present about our care coordination process, because that's where most of the assessments happen, and also through the the concierge team and our customer service team that presented last time. That's where also some of the assessments happen. So what we thought to do is to just take you on a road trip to virtual, to just describe what our care coordination process. So through it, you'll understand how these assessments work and how we use these assessments. So first, how can basically the Trillium CCO help? So we basically have really multiple ways that we connect with our members and for variety of needs, for whatever needs that they are, telling us that they need help with. Also, we're partnering with, with the PCPs, with behavioral health, with oral health teams, to make sure that we are capturing that holistic, approach of supporting our members. And you'll see how the assessments work as we are really working on meeting the needs of the members. So in our toolbox, there are different tools to discover members that may need assistance. So we basically use screenings to based on evidence-based practices to assess the needs of the members. Even though a member may have one very apparent need, there may be others that contribute to barriers that prevent successful resolve. As we know, sometimes social determinants of health do come up as in the conversation as a member is presenting one need that they have. So we really use that holistic approach to support the member in all of our program areas. So there are the routine reporting. So there are we look at hospitals, inpatient emergency department reporting. There is claims reporting, long-term supports and services reporting. There's prospective risk as well. And there's also assessments and screenings. There is something that's called initial or annual risk assessment. And this one basically We make sure that we are reaching out to every member every year, to look at what their needs are. We ask multiple questions about, their language, demographic information, how has it been, being members with the plan, what kind of additional needs, new needs they have. The initial assessment comes in within the first 90 days. And if we are not able to, to get them on the phone, we send them letters to say, hey, this is your time to do the assessment. Please fill out this survey so we can, touch base with you. And in case we don't get, to have the members and connect with them, we work with our community health workers to, to reach out with members, and we work with our community-based organizations, you all basically, to support the outreach. And we have also focused types of assessment and screening. We have transitions of care, mother and baby, chronic conditions, care transitions. With the care transitions, basically it's every time anyone is transitioning from a hospital where they find out if a member has received all their durable medical equipment, all the medications, if the member understands the medications that they were given, basically if they have a follow-up PCP appointment after the hospital visit, and all these things. That's what that assessment is about. We also have something that's called social determinants of health screening. And that one, our community health workers fill out. And when I say community health workers, they're within Trillium. We have that particular screening that looks at the barriers that our members are experiencing every time they talk to our community health workers. So these are some of the tools. So some of our favorite tool, in addition to the screening and assessments that we just went through, is referrals. We get referrals from our primary care physicians, from our member representatives, from community agency partners. So this basically is, you can think about it as we had that question before from you, how can you advocate for your clients? So this is basically where you come in too. You can call into this number with your member, with your client. You can fax information that you want to support this client with this, and this client is this is the client's needs. This is the client's approval that I talked to you, or you can email all this information. One of the things that I know that has been a question of yours in the past is the the PC the community partner help with with the communication between us, the care coordination team, and the and the member and the community partner. Usually, the community partner can speak and advocate on behalf of the member, and we welcome that. This is a partnership. This is a coordination work. If you get the member on the call with you and us, whoever you can get, customer service or a care coordination person on our team, you can get a verbal permission that will expire in 14 days. So you personally can call with that, having that 14 days at any time to communicate the needs back and forth. Another thing that we can do is that you work with your client to fill out what I just put in the chat, what's called an authorization to disclose protected information, protected medical health information. So you can fill it out with your member. The member can say exactly what information you want, we and you want us to disclose about them, and the duration of that disclosure. This way, we can have an open path of conversation with you, even without the without the client or member being present in the communication. Another way is that we are, we're always able to connect with also the community partners that we are contracted with, open way communication, because they do have the provider portal, so they have that, that additional, communication with us. So what happens after we connect? So we have members receive outreach from case management staff offering case management or care coordination. So we get that outreach need, and then the outreach, or if we can't get to them, we get an outreach letter to them in the mail. If we can get to them by phone, we have screening and assessments are done to determine all of the members' needs and barriers. And then a care plan is developed from the needs and the barriers based on what the member wants and is ready to work on. And then the assigned care case manager or care coordinator is considered one of the point of contact for the member. So once that established, the member can just call in to the care manager. They don't have to go through the whole process of getting to the service desk and then to the care manager. And then, there will be routine telephonic outreach from our care manager to the member to ensure that the care plan is, is on the path to for what the goal is set up for the member. And then we have community health service representatives, or also our community health workers, that's another name for them. They may do home visits to support navigation and coordination with identified social determinants of health needs. So they use that assessment again to do that. So what is CC and CM? So CC is care coordination, CM is case management. And that is basically a full department that falls under it is physical, behavioral, and oral health. We have RNs, PS, PCs, program coordinators that basically work directly with you, with the members, with all the care teams to basically deliver that that holistic approach that we were talking about. So the case management is basically looked at as a more high touch in regards to members with multiple chronic conditions that they are managing, or complexities in specific disease processes. As you can remember from last time when we presented about care management, we have complex case management, so that falls under that as well. Some of the main focus areas that we use these tools to help our members with is we have Start Smart for Your Baby. So this is basically from pregnancy to postpartum. The CM supports from identification of pregnancy throughout postpartum phase and beyond, if there are needs for any support for the mother and the baby. And then we have complex case, so multiple chronic conditions or complex diseases. So the goal here is basically to support ongoing needs and provide education on how to successfully manage chronic conditions to improve quality and longevity of one's life. And then we have transition of care, which members are contacted while inpatient to assess and remove barriers to safe and timely discharge. And then we have post-discharge, so that's to follow with the ongoing needs. And then there's ED utilization. So this is for members with 3 or more visits to the ED within 90 days. So we basically make sure that we're contacting these members with frequent ED utilization to identify and remove barriers, and connect them with their providers and PCs. And then we have pediatric and foster children. And that one is basically, the goal is to work with parents, foster parents, and DHS caseworkers to identify any behavioral, physical, dental, or or any needs, and connect with appropriate resources and providers. And within that all, tools, we also have the health-related flexible services that we presented about before. And this one, I want to make sure that we are clear on this one, because we've had a lot of questions about it, even after we presented. So flexible funds are, basically, they are an option for our members. And the way we do it is we do it with our care coordination team. So so the question is basically, are flexible funds an option through this care coordination process? Is it automatic that once you're with care coordination, you get flexible service? The answer is anyone and all members or Trillium members can apply to get flexible services. And the way that this happens is that for all eligible members that currently are eligible for the health plan, they can apply for the service with their care coordination. And remember, these flexible services they come after we exhaust all the provided resources in the community, or available resources in the community. So that's why we ask that the care teams that we work with, you all work with us to find the resources that are available. And if we are exhausting these resources, then we work with you to get our members, the flexible funds, for any of the items or services that are not billable or not covered under the health plan. And these are the contact information. So we will be having the form online soon. I see that you want some, yeah, so like air conditioning, that's an easy one. That's the one that comes up a lot during the summer. Air conditioning is not, it's not covered under the health plan or eligible benefit, but at the same time, applying for, for flexible fund with you, the one that knows about the member, and us working with the member. And it has to be, it has to go with their care plan. So if their care plan has to do with, heart disease or high blood pressure, or things that has to do with making sure that we want to keep this member healthy and have healthy outcomes, then we will work to support this member to get the air conditioning and apply. It's basically comes in as requested, and case by case as well. I do want to respect the time, and I know that I took a lot of time for our partners at HealthShare to present, and then we can go through some questions.
Perfect. Thank you, Ms. R. And I'll keep an eye on questions as well, because I feel like some of them might end up pertaining to both of you guys. But that was fantastic, and thank you for going through that. Jeremy, do you want to dive in next?
Yeah, let me give me just a minute here.
No worries.
My screen sharing going.
Okay.
Are folks seeing that okay? Not anything yet?
Nope, not seeing anything yet.
Okay.
Oh, looks like it's working now. We can see a PDF.
Okay, good. Are you seeing the operating model there?
Yes, we can.
Okay, great, awesome. Well, hello everyone. My name is Jeremy Kohler. I'm the Director for Integrated Services at HealthShare of Oregon, he, him. And I think it's always helpful just to start off with a refresher on the HealthShare structure. We're structured uniquely as a CCO because we have multiple health plans that are under the HealthShare umbrella. So HealthShare, we hold the CCO contract with the Oregon Health Authority, as you can see here, and we have 5 medical health plans that work under HealthShare. So when you have HealthShare as your CCO, you have the choice of one of these 5 health plans. That's OHSU Health, Legacy Health, Pacific Source, Kaiser, Providence, and Care Oregon. We also call these integrated delivery systems. So generally speaking, if you're going to primary care at a OHSU clinic, then you'd be on the OHSU health plan. Same thing for Kaiser, Providence, and Legacy. Care Oregon is a bit unique. They contract with FQHCs and a lot of the independent clinics all across the region. So for those first 4 on the left there, there's some exceptions, but generally speaking, if you're in primary care, you're also in that health plan. Care Oregon is our integrated community network where they're contracting with clinics all across the region. So a bit of nuance to that is that, so we do have the 5 medical health plans all referenced there kind of on the left side of the screen. But we also have the behavioral health network managed through Care Oregon. And that is for all HealthShare members, regardless of which medical plan you're on. So we have 5, and really the difference between these medical plans is really the network, that each one of them has their own unique provider network. That's not the case for behavioral health. We just have one HealthShare behavioral health network managed through Care Oregon. So if you're Kaiser, you still have Care Oregon for your behavioral health benefit and the behavioral health network. So everyone has access to the same behavioral health benefits. The dental is also managed through Care Oregon, and through that we actually have 5 different dental plans. And the main difference, again, just kind of like the medical plans, is really just the network. The best way to access any of these plans, you're trying to figure out who you need to talk to for what. It's always going to be on the card. So the physical health provider is always going to be right there in the upper left of the card. The behavioral health number is always going to be right there at the bottom, and the dental plan is always going to be right there in the upper right. I think just like Trillium talked about, the care assessments are really primarily driven through the care coordination process. Here, these are the sorts of questions that typically come into our care coordination teams. And again, because of the HealthShare structure, we have care coordination teams that are integrated into each one of those provider networks. So Kaiser has care coordination teams, Providence has care coordination, care management teams, Care Oregon has those teams. And then we have behavioral health care coordinators that are housed at Care Oregon that branch across all of HealthShare. And the same thing for each of the dental plans as well. So we have those care coordinators integrated within each one of those networks and within each one of those health plans. There's not people at HealthShare proper with the role of care coordinator. So this is an example of what Care Oregon's care coordination looks like. So it's a large, member-focused, multidisciplinary team, and there's a lot of roles. There's triage coordinators, there's behavioral health specialists, there's nurse case managers, oral health support coordinators, health resilience specialists, healthcare coordinators, and they're doing a lot, and they're doing they're doing screenings and assessments, and those happen in a really wide variety of settings. I think there's let me see here. There's likely a really long list of places where we get our health information, and kind of the screening and the assessment process and how we follow up. The most basic is the health risk assessment that we do for all new members. Those are typically done by telephonic healthcare coordinators, where they're making phone calls and trying to reach out to folks. If we're not able to reach them, we send letters, and continue to make multiple attempts to reach. Those are kind of, simple, straightforward screenings where we're trying to identify risks in a variety of areas, chronic conditions, social determinants of health, and just kind of understand what's happening with the member. We also have claims-based screening and eligibility-based screening. So there are certain flags we get from the Oregon Health Authority about a member's eligibility file that might make us want to reach out to the member and see what additional needs there are, and just make sure we're taking care of those. Like a good example of that is, a kiddo in foster care is something that's flagged for us, or a member that's in long-term care, long-term supports and services. We also do claim-based outreach. So we may look at just an example of what that looks like. We may have somebody that has we can see through claims, has a diabetes diagnosis. And then we can also see through claims that they don't have a recent, A1C score or something along those lines. That's looking at monitoring their insulin levels. So we can see through claims that we may have somebody that has this chronic condition, but they're not engaging in care, in the way that you would want them to. And so then that triggers nurse case managers and other outreach coordinators to do additional targeted outreach to those individuals, and to follow up and just trying to understand what's happening there. Maybe they're getting their needs met somewhere else that we're not aware of, or they just haven't been motivated. And so we'll do a lot of things with those members, more thorough and detailed assessments, to try and understand what's happening, what the risks are, and then coordinate with providers on their behalf to try and get them back in care, help set up appointments, help set up non-emergent medical transportation to get them there. We also, as Trillium mentioned, we have emergency department reports that we get. We're hooked into, all of our plan partners are hooked into the regional EDI pre-managed system. So all the EDs in the region collectively put their data into there, so we can see when members are showing up. And once we get someone that's had multiple ED visits, we also do that kind of targeted outreach. And likewise for transitions, from people are moving from one level of care to another, that's again another opportunity where our care coordinators will reach out. We also get flags from the state around people with serious and persistent mental illness. They call it the SPMI flag. We do additional targeted outreach there. And that's one of the places where we do an assessment for ICC, which is ICC. We talked about that, I think, a couple months ago, but that's intensive care coordination. It's part of our CCO contract to do that. And that's where we do kind of like a deep dive assessment. And that's typically really high intensity care coordination for folks with serious and persistent mental illness. So that was a lot of information. I guess I'll just stop there. I guess the last thing I'd mention, likewise with Trillium, all of our plan partners participate in health-related services or flex funds, and those are often accessed by their providers and also by all of these care coordinator roles that we have. So if folks have questions, be happy to take them.
Awesome, thank you, Jeremy. I don't see any huge amount of questions, but one thing that while folks are kind of thinking about anything that they might want to ask, I did want to just kind of ask you guys in more of a general term. So is there, because it sounds like, Masari, you mentioned that there are some community partners that are associated with Trillium in part of that, I'd say, that care coordination outreach process. Do you guys see if there is, or see an opportunity or a way that community partners can better help clients to be successful in essentially getting these initial screenings completed? Or are there any partnership opportunities or ways to kind of connect with this beginning process of getting clients assessed for care at all?
Yes, yeah. So, so sometimes some members will get these assessments in the mail if we couldn't reach them by phone. So, you know, what happens is that if a member sees this, or if the, if the OHPS sister sees it, or if any of our community partners sees it, and they want to help, you know, our members to fill it out, or to, you know, even reach by phone, like, I'm not gonna do the mail thing, I'm just gonna do the call, you know, they can call together into our, you know, customer service, and you know, and establish that, you know, that assessment with us, as long as, you know, it's like a three-way call, and we've done this a lot. Really, our care managers really love that, you know, that partnership between the care managers and the community partners, because in the end of the day, you know, we all need each other, you know, to make life better for our members, right? So we're always looking for, you know, for your support, you know, to connect with our members, and vice versa. So yes, we are always, you know, we're always working for the benefit of our members, whatever that's, you know, whatever that looks like. So yes, if there's any barriers, and I know that there are, you know, there's language barriers, there's, you know, transportation barriers, there's, you know, there's time barrier as well, you know, for our members. So we want to make sure that if you have the connection with them, you know, even within that 15 minutes of connection with them, to call us, really. And yeah, I hope that answers your question. I know that was one of the questions that came up. Another thing is the social determinants of health assessments. These are actually great tools for us, as Jeremy also explained with HealthShare. So these really tell us, they give us a holistic picture of all the needs that our members are, you know, have, even ones that, you know, that don't come up in like initial or annual assessments. So by you reaching out to us, we are able to establish these assessments and go through the needs and meet them.
Awesome. Thank you, Ms. Ara. That's fantastic.
And likewise, we certainly, I think anytime you are coming across someone you know as a HealthShare member or as a CCO member, and you know, they're not connected to the care, you know, and they don't have the right resources. I mean, any of our plans will have the care coordination available to kind of get whatever the right assessment path is to that individual. Yeah.
Awesome. And just another follow-up that I had about usually what's roughly the timeline when new members join, when they might have someone reach out to them. Just if say like a community partner were to say, hey, you may receive a call within a week or two, someone trying to do answer some questions or gather information about you. Just so that folks, because I know a lot of people don't answer their phone sometimes, nor do they have voicemail set up and things like that. And it can make it difficult to reach clients. Is there any guidance that you think you could provide for community partners so that they can help set clients up for success on that?
Go ahead.
No, you go. We're required by contract to do it within 90 days.
The 90. Okay.
So it definitely happens within that window of time. I think you know, it probably varies, but my understanding is it usually happens within the first 30 days quite often.
Perfect.
Yeah, same wise. And there are sometimes also some cases that we actually just reach out earlier than the 90 days. So if a member is experiencing like complex needs, or that we have been reached out to, you know, by one of our community partners, that we need to connect with them to coordinate their, you know, their needs right away. So, you know, these members get reached out really fast, you know. So yes, the 90 days is for sure is what we're contracted with, and we definitely try to do that even earlier than that.
Fantastic. Deanna, did you have any questions at all or anything that you want to?
Do have a question. How
Go
could you
for it.
tell? I was wondering, so, we have people are on open card for the first 2 weeks or so of being on OHP. And during that time, their care coordination entity it's managed by KeyPro, right, which is the state's contractor to do that care coordination for open card folks. My question is really about any coordination that might happen between KeyPro and either HealthShare or Trillium when they have a client who has been getting some intensive care, who's now coming into the CCO. Is there any communication there? What might we expect, or is there anything a community partner can do to help facilitate that?
Yeah, we do have that. It's not super common in those cases because typically, just in my experience, the members that KeyPro is managing in intensive care coordination are folks that are on open card for like a longer period of time. And so when we see, so we definitely, our teams definitely do collaborate with KeyPro when we're transitioning a member from open card to the CCO, but quite often, it just doesn't happen a lot in these cases where someone's been on KeyPro for, for like an open card for a week or 2 weeks. It's usually not long enough for them to be open to care coordination, unless it's a really significant situation. And oftentimes when it is a really significant situation, we'll actually do an expedited enrollment onto the CCO. So that's where we're working directly with the OHA to kind of put someone on the CCO immediately without having those kind of weeks. So there is a kind of hand managed process for really complex cases where we can do that.
For us, I'm gonna actually have David Hidalgo. I have one person from our tribe with us to answer this question. David Hidalgo is a senior manager of business development. Please, David, could you give us some light on that? Shine some light. You're muted.
Mute. There we go. How does that work?
Perfect.
Great. Thanks, Massar and Jeremy. Great presentations. And as Massar said, I work with her on our team, primarily in the area I think that your question falls into as well, Deanna, around our contracting and coordination with provider networks, and as well with our behavioral health services. So I think, as Jeremy said, perhaps not as common unless there is a high-profile need from the coordination of KeyPro over to the transition with the health plan. However, on a continuity of care basis, we often will hear from providers who are seeing a member who has just transitioned. They will often contact either through our member services, much as Massaro described, or will actually contact us directly through our contracting group to say, I'm seeing a member currently, how do I ensure that I can continue to provide care? We're very responsive to ensure that members who are currently in care, that we respond back to those providers and say, please continue to provide care. We're happy to work with you. For continuity of care purposes, we are happy to authorize continued services to ensure a member has access to needed care that has been provided, and then we'll work with you on future steps in the member. If you'd like to contract with us directly, we will offer a contract to the provider, or if the member wants to talk around other options, we'll do the same. So I think it comes through a couple channels. We may hear from a member, but often providers are right on that, which is really terrific. Does that help?
That's great.
Good.
Yeah. Thank you.
Yeah, it's good for us to better understand too how all those pieces are coming together to make sure that the client is getting better access to care. So I think that's awesome. Let's see. Anybody else? I just want to make sure folks have an opportunity. I haven't seen a whole lot of questions come through the chat box. There's a little bit of a request from Mara to explore a little bit more into flex funds, which I'm thinking, I'm not sure how you guys feel. Maybe that might be a topic that we can tackle next time if we want to dive a little bit more into what that flex funds process looks like, if it might require a little bit more in depth. But I wasn't sure if anybody else, feel free to unmute yourselves or raise your hand, and I can pick on folks if they have any questions about that kind of care assessment or getting folks started with their CCO. And if not, that's also totally fine.
Well, I can say that Jeremy and Masara will send us their presentations, and we will post them on group site under, I think it's regions, metro region, CCOs, and that's where we post all of these materials. So you will have access to both this recording as well as their presentations. In fact, Sean, I'd like to put the link to this recording into those PowerPoints before we post them. So it's right there.
Okay, yeah, I think
I'm
that's
saying that as a
perfect.
mental note, so we are both on it.
Okay, sounds good. Oh, let's see. So Heinz actually looking for examples on what resources we are expected to explore before. Oh, okay. I'm not sure if you guys feel like that's something that we can answer. So it's looking, I guess, Mara, and feel free to unmute if I'm not rephrasing your question in a way that makes sense. It kind of like what paths do they go through prior to exploring flex funds? I guess is kind of the question that she's looking at. But if that's something we feel like would be better later, that's also totally fine.
Yeah, it's one of those the CCO requirements around the use of health-related services, and Medicaid in general is often seen as kind of they call it the payer of last resort, and so that kind of general philosophy applies to health-related services or flex funds, and so generally speaking, there should be some, when people make flex fund requests, some demonstration that this resource isn't already widely available in the community. So it's not like you have. So generally, I've not seen people really need to do a ton there. Typically, if someone's coming and asking through the health-related service process, there already isn't an obvious community resource there. But I think just simply stating that is helpful, and that generally will always help the request. Yeah.
Yeah, same thing with Trillium. And I think the key here is really the communication that we have with our community partners, and and who's helping the member submit the forms. We have our community health workers working with our community providers to submit this form for them and to look at the available resources. So even if you've done work and looked at the resources in the community, we come back and work with you on if we've missed any resource here or there, that we are making sure that we have exhausted the resources. And then after that, then we look at the request that is submitted, look at how it meets the care plan for the member, and then the determination is made after that. So it's really when we're saying like what kind of resources, all types of resources that is in the community that is specific for that need or service. So it's either item or service that is out there. Yes, this question is very related to basically the flex fund services. So if there are questions that are coming up in terms of the flexible services, let's do another presentation about it. Really, let's dive in and talk about it. There's a lot of specific questions, and sometimes we won't be able to answer, because if you tell me like, can you approve this flexible service item, I can say we can try, but I cannot say like, yes, this is going to be approved, because it is case by case type of fund. Yes.
Perfect.
I'm gonna stop here because I can't go forever.
No worries, appreciate what Sarah. Yeah, I think it's always helpful to revisit things, even if we have in the past, because I feel like it really helps to really paint a good picture on how these pieces are all fitting together. So, as we all do, we'll talk more on kind of what we end up wanting to decide for our next topic, but that sounds like that might be a helpful step. Mara, I really appreciate it. Thank you for your question. I hope that was helpful to provide a little bit of guidance there. But again, too, something that's really nice is that, you know, we always have new people that are able to join these collaboratives. So it's always good for us to kind of revisit topics. And I know for me, it takes like 10 times before it enters my brain and
Same.
sticks there.
Yes.
So, well, perfect, guys. Again, thank you so much for taking the time to put that presentation together. Thank you, Jeremy and Masara. I'm going to go ahead and stop the recording for now. We'll keep an eye out for your guys' presentations and stuff and make sure everything gets uploaded. And again, thank you so much. I appreciate it.